Good evening, everyone, and welcome to the Sleep Solutions for Pain webinar. My name is Asia Lee, and I'm the Director of Patient Education here at the Arthritis Foundation. And like many of you, I am also a patient. I was actually diagnosed with an autoimmune disease during the quarantine of 2019, so I am a lupus patient, and I've spent my time since then looking for ways to help the community that I now am a part of. And we all know that sleep is critical to healthy living, but it's even more important for those of us living with a chronic disease like arthritis. But unfortunately, pain can get in the way of the rest that we really do need to thrive. And it's a vicious cycle at that. Too little sleep can cause even more pain, and more pain can cause more sleep disruption. That's why tonight's discussion is so important. Our experts were shared strategies for getting better rest with arthritis-related pain, including tips about sleeping positions, bedtime props, medications, and more. So before we get started, a few housekeeping notes about tonight's event. We have muted all attendees for this event, but you can direct any questions you may have throughout the presentation to the Q&A box at the bottom of your screen. We'll start with the presentation and reserve some time to answer questions at the end of our discussion. After tonight's session, you will receive an email asking about your experience. These surveys help the foundation better plan for future events, so please take your time to figure them out. A recording of tonight's event will also be included in the post-event survey email, as well as available on the Arthritis Foundation's YouTube channel and Webinars Hub. Now let's get started by introducing tonight's wonderful guest experts. We have Dr. David Kloth. Dr. David Kloth is a renowned leader in the complex chronic pain management and practicing interventional pain management for more than 30 years. He is currently the section chief and medical director for interventional pain management at OrthoConnecticut. He mentors the pain physicians in the training and has co-authored numerous journal articles. Dr. Kloth has also served on many medical societies, including the president of the North American Neuromodulation Society and the American Society of Interventional Pain Physicians. For more than 20 years, Dr. Kloth has advocated for the chronic pain community, working with hundreds of state and federal to help expand coverage for treatments. His book, Pain Wise, is available on Amazon. We also have Natalie Rolle. Natalie holds a master's in occupational therapy and specializes in behavioral sleep treatment. She is nationally and internationally recognized for her work in cognitive behavioral therapy for insomnia. In 2018, Natalie left private practice and developed a sleep services program at Colorado State University. She currently serves as its director and lead OT supervisor for the program. Natalie does multiple presentations a year and works with fieldwork and doctoral students to help bring the field of sleep more into occupational therapy practice. We also have Dr. Brett Neilson. Dr. Brett Neilson holds a Doctor of Physical Therapy and Doctorate of Science in Physical Therapy. He's both board certified in orthopedics and is fellowship trained in orthopedic manual physical therapy. Dr. Neilson is assistant professor at Hawaii Pacific University's Doctor of Physical Therapy program and has presented at both state and national conferences. He has published several peer-reviewed articles, and his current research agenda focuses on the relationship between sleep and pain. He continues to practice clinical care in the state of Washington for in-home outpatient physical therapy company. And to round us out, we have Dr. Mark Shepard. Dr. Mark Shepard holds a doctorate in physical therapy and doctorate of science in physical therapy. He serves as the program director of the Orthopedic and Manual Physical Therapy Fellowship Program at Bellin College. He previously served as a clinical faculty for the Johns Hopkins George Washington University Orthopedic Residency Program. For the past 5 years, he has presented nationally and performed research about sleep and pain. So let's get started. Why is sleep so critical to proper functioning with arthritis pain? And what happens if we get too little sleep? Dr. Kloth, would you like to get started?
Sure. Thank you very much, Asia. As you alluded to in your introduction, pain and sleep are very interrelated. And so pain can cause you not to sleep. And when you don't sleep well, your pain can be worse. And so these is a vicious cycle, as you described. And so it's important to try to get good sleep if you're going to help manage the pain during the day as well. And so these things are very interactive. Patients with arthritis will typically be very stiff in the morning, and that's because they haven't been moving. They've been lying around at night. And so even though that sleep is important to help the body recover, they still might be a little stiff in the morning. They tend to loosen up midday. And then again, from use of those joints and wear and tear during the day, they tend to be again sore at night, which then can make it difficult to sleep. So there's real reasons why there's this variation in time during the day, and it's important to try to address that. I think always one of the most important questions is why you're not sleeping. Is it the pain that you're not sleeping? Are you not sleeping because of anxiety or not sleeping because of sleep apnea? So starting with understanding why you're not sleeping is very important.
I'll go ahead and jump in again, Asia. And so something that I thought I'd just kind of, bring to light, if you will, is, some of the statistics or, understanding of how impactful this problem is. So Mark and I have been, part of a research team that's been really looking at not only, the intersection between sleep and pain, but also on sleep beliefs. And so I thought I'd just kind of chime in here and share just a little bit about that. And so having pain or having sleep difficulty when you have pain, about 1 in 2 people, are experiencing pain. And so are experiencing sleep issues when they are having pain, that being, spine pain or arthritic type pain. And when you are experiencing, pain, it kind of almost creates this vicious cycle where, and Asia, you alluded to this, where, the more pain you're having, that can actually increase anxiety and fear and whatnot, which, can disturb your sleep and limit how much sleep you're getting, which then kind of feeds into the whole, pain sequela. And it's almost this vicious cycle that goes around and around. And so hopefully, tonight through this discussion, we'll start to uncover maybe some little clinical pearls and little tips that maybe, can help kind of break or intervene on that cycle to help you get better sleep and help you better manage some of the pain that you're struggling or dealing with. So I don't know, Mark, if you have anything else that you want to add there.
No, I think you covered some good points. And just to echo Dr. Kloth's point about the vicious cycle, same with what you were saying, Brett. The interesting research we've seen and was a shock to me is I used to think people were having difficulty sleeping because of their hip pain, knee pain, back pain, what have you. But we're seeing that sleep, if you're getting poor sleep, poor quality sleep, or you're not getting the amount of sleep you should be getting, that can actually be a greater driver of someone's pain experience than the condition, let's say, or osteoarthritis that they have. But it is bidirectional, meaning, as Dr. Kloth said, by the end of the day, you can be experiencing difficulties in tolerance to standing or moving around. You go to bed, you're achy and you're not feeling very good, which keeps you up, which inherently makes you not be able to have good quality sleep at that point. So it truly is a vicious cycle. But I think when you look at sleep on its own, it is such a huge driver of sensitivity to daily function that it was just something that in the physical therapy world, we're starting to see more evidence saying, hey, as a PT, you may not be thinking this is something we should be asking about because you probably think we're going to do exercise or some hands-on treatment, but we need to address sleep as part of a comprehensive treatment plan. So it's very enlightening to see this happening, but it's newer to the PT realm too, and it's encouraging to see more people interested, and even to be on a call like this tonight as a physical therapist. So again, thank you for having me.
Just gonna add one more thing, if that's okay, Asia. Thank you. I just wanted to bounce off what everyone was saying. It's such great information. And if you do go talk to your doc, if you're having sleep problems, go talk to your doc. That's the first step. A lot of people don't bring sleep up, and a lot of primary care docs, not to their own fault, but just don't ask about sleep. We haven't asked about it for a really long time. So I think it's important to bring it up, but also I think it's good to be aware that the new DSM-5 actually classifies something like insomnia as a primary disorder. So it's no longer looked at like a secondary disorder. And what I mean by that is, let's say you have pain and insomnia, or anxiety and insomnia. Research today now shows you really need to treat both of them. They really bidirectionally kind of contribute to each other. And so it used to be a belief that you could just treat that anxiety and the insomnia would just go away. But that's no longer the belief today. You really have to treat the anxiety and the insomnia, or whatever the sleep trouble is, whether it's apnea, restless leg, whatever it is that you've got going on, getting to the bottom of that and treating both your pain and that sleep problem specifically.
So now that we know why sleep is so important, the elusive question on everybody else's mind is how. So we'll start addressing medications for sleep and arthritis pain. So Dr. Kloth, we'll start again with you. Many people on this call likely have taken over-the-counter medication like Tylenol or Advil PM to get better rest. Are these medications safe? Do they have short-term or long-term effects? And how can someone properly use these medications to reduce harm?
So you're going to hear this as a broken record from me on medications, but any medication has potential risks. And so every single medication, even if it's something as simple as Tylenol, has potential risks, and you have to understand that and understand how it interacts with your other medications. So as an example, if you're on a blood thinner, taking Advil or Aleve wouldn't be a good idea because it could increase your risk of bleeding. So sometimes even the simple over-the-counter medications can be dangerous. So I encourage the listeners to discuss this with their doctor and make sure that they understand what they're taking and why. As an example, Tylenol, which is a pretty simple medication and is generally safe, but that's at specific dosages. If you take too much of it on a daily basis, you can get liver toxicity. And you might not think about it, but let's say you're taking a couple of Percocet a day, and then you start to add Tylenol on top of it. Well, Percocet contains Tylenol. And so now you might be taking what is on a chronic basis, a toxic amount of Tylenol. And there are a number of studies which show that Tylenol contributes to liver toxicity. And so it is important to be aware that sometimes it's not that simple. Similarly with the anti-inflammatories, it can interact with other medications. It can cause both liver and kidney damage. So it's important to be monitored while you're taking them. All that said, these are generally pretty good medications for most patients. I don't worry about the patient who's taking Tylenol a couple times a week or something like that. But if you're taking Tylenol 4 times a day and you're taking 2 extra strength Tylenol every time, that is actually a problem for the liver. So again, it's all about balance. I would urge you read the, package inserts and talk to your doctor and make sure these aren't interacting. But that said, these medications can be helpful if in your particular case, those are good choices. Tylenol will generally help with pain. The anti-inflammatories are good for arthritis. For a lot of my patients with generalized arthritis who can tolerate an anti-inflammatory, I'll actually give them a non-steroidal at bedtime, a longer acting anti-inflammatory that goes for 12 hours so that when they wake up in the morning, they're not so stiff. And so, and for sometimes those medications are even twice a day, but I'll only give it to them at the nighttime to help with that specific time period when they're getting out of bed in the morning. The reason I may do that is to decrease the risk of toxicity to either liver, kidney, and also stomach, because the anti-inflammatories can be also very tough on the stomach. So there are all different types of anti-inflammatories. Again, urge you to talk to your doctor about that. The advantage of Advil in some regards, it's less pills. It's a few number of pills and it's twice a day versus Advil or ibuprofen, which is 3 times a day. And both of those, the package inserts will be giving you a recommendation that's about 50% of what would be a prescription strength of that medication. But again, talking to your doctor to understand whether maybe increasing to that prescription strength might make sense. Long-winded answer, but I think it's important that people understand that medications, sometimes you think they're simple and they're not.
I was just going to bounce off of that. I was just going to say, be careful when you're taking something that is specifically over the counter for sleep. So for example, things like Unisom, Benadryl, Tylenol PM, some of these contain antihistamines, and there's new evidence that's come out in the last 5 or so years that they're no longer recommending antihistamine use at nighttime. The American Academy of Sleep Medicine has a paper out on it now, a new statement position paper, just because it can increase the risk of things like Alzheimer's, dementia, that kind of a thing. So just be really careful that what you're taking at night, if you're not taking it for specific to sleep unless you're talking to your doctor, and be careful of those over the counter, because a lot of times they might contain things in them that you're just not helps you fall asleep, but because it has likely some of those antihistamines in it. And with melatonin, you just want to be careful, of course, because it's not regulated. So any melatonin you take off the shelf might not have in it what you think, because it's not being regulated. And when they look at it scientifically and with research, a lot of times it shows that it has more or less. And a lot of times, again, you just want to talk to your doctor before adding something like that, just ad lib.
You can talk to your pharmacist as well, can provide you with information. And you might want to do research. What is a good product if you're going to think about the melatonin? So, it's, again, a little research can go a long way.
I was just going to chime in too that something that was eye-opening for Dr. Shepard and I is the amount of patients who are taking medications for sleep, but yet have not talked and discussed with their physician about their sleep issues. So even if you're finding that you're taking a sleep medication or melatonin, once in a while, but it's becoming more frequent and regular, that might be, really a early sign that there's an underlying sleep, disorder and condition that is much easier to treat in its acute and early stages, rather than letting it fully blow into a more of a chronic and persistent issue. So if you haven't talked to your physician, but are taking medications, to help facilitate sleep, I highly encourage you to, kind of make that appointment and start some of those early conversations so that you can, get the help that you really, the skilled help that you really may need. So
let's actually get into prescription sleep medications and painkillers. So Dr. Kloth, let's circle it back to you. What do you tell your patients seeking these types of treatments, and are they safe?
Depends on the patient. So let's say your problem with sleeping and the reason you can't sleep is sleep apnea. Well, that's the last patient that I want to give benzodiazepine, like a sleep medication like Ambien or Xanax to, or even a painkiller, because that's going to suppress the respiration more, and maybe they stop breathing when they're sleeping, and that's obviously a bad thing. So again, it depends on the individual patient. And I'll go back to what I started in the beginning, is that you need to understand the cause of the pain. So let's say the cause of the pain is intractable knee pain. Well, my advice would be to try to treat that knee problem, either with therapy, an injection, maybe it needs surgery, but fix that individual problem that's keeping you awake rather than trying to take pills to mask it. Now, in the situation where, let's say the patient's done everything and maybe they even had that knee replaced and they're still having pain. Well, then in that situation, using pain medications at night in a judicious fashion in conjunction with your physician can be very effective. And depending on the patient, their tolerance will depend on what medication you may choose. I tend to be very careful and judicious with medications like that, but I do also think they have a role. And I have many patients who take chronic medications. And for some of those patients, they take something different during the day, and they'll take something different that may be longer acting at night. So there's a lot of things that you can do that you can individualize at each patient based on their particular individual circumstances. And I know I keep saying that, but it is true. I look at every patient that comes into my office as a complete distinct individual, and no two are the same. And I have to treat them each that way.
Okay, so what about other prescriptions for sleep, like anti-anxiety or depression drugs used off-label, like a Xanax or a Ativan? What are your thoughts on that?
My experience with the chronic use of any of those medications for sleep, especially the benzodiazepines, good for 3 weeks or so, and then they're not working anymore, at least in my experience. You'll get some benefit for a short time, then they can increase the dose and they'll work again for a little bit, and then they'll increase the dose. And next thing you know, on a real big dose, and they go, geez, we have to take you off of that. When they take you off of it, you're really not going to sleep for 3 months. So in my experience, if you're using a pill like that, an Ambien, any of those sedating medications, if you use it once a week, maybe twice a week, you might find it effective on a long-term basis for those individual nights when you're having a problem. If you take it every single night on a chronic basis, it will stop working and you're going to be back to where you started. At least my experience, that is not a long-term solution. Treating an underlying pain issue is different. But trying to medicate that way with anti-anxiety medications, not particularly effective. Now, you bring up another class of medications, antidepressants, and there are certain antidepressants that have sedating properties that will not build up tolerance like that you can use. Drugs like amitriptyline. But those drugs have a fair amount of side effects as well. Weight gain being one of those. And if you have sleep apnea, gaining weight wouldn't be a good thing. If you have arthritis, putting weight on your joints is not going to be a good thing. So balancing act, discussion with your physician, which is the best drug for you.
I just was going to add, I love everything Dr. Kloth is saying. That's so great. I do want to just put a little pin in. If you're dealing with something like chronic insomnia, which again, if you're not sure, the number one thing, again, just to repeat, go talk to your doctor so you know what you're dealing with. Because if all you have is a hammer, everything looks like a nail. So you have to be very careful that you're not diagnosing yourself and that you're going in, because a lot of these sleep disorders can look like each other, and it takes someone helping you to kind of decipher out what's going on. If you're dealing with chronic insomnia, I do just want to say, as of 2016, the American Academy of Sleep Medicine now recommends medication not be first-line treatment specifically for insomnia. Only because, exactly like Dr. Kloth said, they work great for 3 weeks and then they lose their effectiveness. You start to have to increase the dose or change the med. And at the end of the day, they've now found when it comes to chronic insomnia, the number one recommended treatment is behavioral, something like cognitive behavioral therapy for insomnia, which you can do on your own. There's apps, there's books, or you can go to a specialist like myself. You don't need to go to a specialist like myself. A lot of people can get the information and kind of take off with it without extra help. Again, you want to make sure what you have is chronic insomnia, and just know that those meds, while effective and great for short-term insomnia, or if you're traveling to another country, if you're going to Australia, definitely, they've got a great place for short-term use, but long-term use of those, just like Dr. Kloth was saying, night after night after night, it's not going to work for you, and you're just going to end up on those meds and still not sleeping and really frustrated. So just make sure you're kind of looking into that research and finding some of those behavioral strategies that we'll talk about today too.
So what about medications to treat arthritis? Can those cause sleep disturbances? And if so, what's the best way to take those to reduce sleep problems?
Well, the only one I would say that I for sure is prednisone can cause excitement and sort of a manic response and give you insomnia. So if you get a steroid injection or you're taking prednisone, you can expect that you might have trouble sleeping for a week or so. Now, if you're on chronic prednisone until you get off it, but if an injection, even with an injection, you can have trouble sleeping for a week or two. So that's not uncommon. I believe there are some of the other medications can have some issues, but I'm not an expert on all of the rheumatologic medications, and so I'm not going to speak on that. If others have other information, please.
Okay, well, to round out this section, besides medications, what other medical interventions can help with sleep and pain?
So, I mean, listen, again, getting to the root of the pain. If you're not sleeping because you have back pain, going to have your back pain treated is a really good idea. As an example, I treat a lot of people what we call facet disease. That's arthritis of the spine. If you treat that and you fix that, often you can sleep better. That gets rid of a lot of the morning stiffness. That gets rid of the pain at the end of the day. I'd much rather see somebody's pain get treated and reduced, and then they sleep better, rather than trying to medicate that pain away or try to magically make it go away, because it's not going to go away until you address the underlying cause. If you have sleep apnea and your sleep apnea is caused by being overweight, then you need to lose weight so that your sleep apnea gets better, so then you can sleep. And so all of these things are interconnected. And it's important to understand that interconnection, and sometimes it's not so obvious. Again, we're talking to your doctor helps, because something that you think is not connected may very well be connected.
And just to jump off of that too, get your yearly evaluations, get blood tests every year, like go in and get evaluated, make sure everything's looking normal year to year. And just like Dr. Kloth said, that you're getting to the bottom of what's going on. A Band-Aid will fix something for a little while, but you've really got to get to the root cause of what's causing that pain or what's causing that sleep issue, and make sure you're addressing those things, and look up that kind of most recent research on each of those different things, because all of them are going to give you a little bit of a different advice, which I know isn't super helpful right now. But also don't be afraid of the CPAP. So I tell people all the time, the last thing anyone wants to do is go in and get a diagnosis of obstructive sleep apnea or central sleep apnea. It's not something that we celebrate or write home about. But I promise you, if you have sleep apnea and you get one, you will celebrate when you start using it by how much better you feel upon using it, because you're not getting the deep sleep you need and you'll feel miraculously better. So sometimes it's scary to go in and kind of figure out what it is that's going on, but don't let that hold you back, because once you can figure it out and get treated for it, which for a lot of times with pain and sleep take people quite a long time, it's hard to keep going in. But I think it's important to keep going in, get to that root cause, and then address it with whatever is going to be the best science, the best research, the best treatment that we have today to address that.
And with sleep apnea, besides CPAP, if that's not effective or works and you can't tolerate it, there is a new device called Inspire, which is a neurostimulation device, which actually is an electrical stimulator that stimulates your tongue muscle and pulls your tongue off the back of your throat. So with sleep apnea, it mechanically opens up your airway. So for some patients with specific indications, that can be effective. So that there are, by talking to your doctor, you will find out other solutions and other possible things that you might not know exist.
Something I didn't know myself. So that was a cool fact there. So let's progress the conversation. So now that we know a little bit about how to use conventional medical interventions for sleep and pain, let's discuss alternative strategies. So we have several people who registered submission questions asking about the best stretches or light exercises to relax the body. Dr. Neilson, do you want to start us off?
Yeah, sure. Thanks, Asia. I love the shift in conversation. It's a little more in my wheelhouse as a physical therapist. But yeah, what I'll start off by saying is there is no like single best stretch or movement or activity or exercise that's going to, magically help everybody sleep better. It is, comes down to individual preference. And the bottom line is that generally you're finding something that's, relaxing. I think the bigger question that I think we get a lot is, is exercising, too close to bedtime a bad thing, or when should I exercise? And there is, some mixed, evidence and research out there, but based on a pretty large study that was done by the National Sleep Foundation, really exercise is good no matter what time of day you choose to do it in. Anything, the only, maybe negative correlate is that, really intense, vigorous exercise and within an hour before going to bed, it may be stimulating. It's going to raise your body temperature, which may delay sleeping. But for the most part, that's not a huge issue for most people, if you will. Most of us aren't, engaging necessarily in high intensity exercise right before bed as a, general common theme. And then I'll just kind of tying back into, stretching or relaxation. So gentle stretching routines, things like progressive relaxation or gentle, yoga type movements can all be really, really great. And, as far as, just kind of helping to find relaxation, a walk around the block also has been shown to be really helpful. And then really one of the things, a study that I really, really enjoy, it was back in 2009 by Dr. Lewis out of University of Sussex, found that reading a book for around 6 minutes is one of the best ways to kind of help relax and calm your body and the muscles in your body to help prepare for sleep. So I'll kick things over to my colleagues now, but hopefully that'll kind of start the conversation.
So what about other ways to wind down, Natalie or Mark?
So I just think in terms of having a wind down, I think it's important. I always tell everybody, I don't know if not everybody's familiar with Mr. Rogers, and I apologize if you're not, but I like to tell kind of my clients, really you got to embody Mr. Rogers. You need to have a wind down period. So I'll get to my point here. I know I said I was going to be fast, Mark, and here I go, given this whole thing. So basically Mr. Rogers, if anyone watched him, when he came home, he took his work sweater off, put a different sweater on, took his work shoes off, put his tennies on, made a very clear distinction that he was done working and he was at home now and it was a personal time for himself. And I think that's a really important thing to note, because so many of us now, I think, work after hours, or we're checking email, or we're on the news, and we have access to the news all the time. It's not like when I grew up and it was at 5 and 5, and if you missed it, that was it. Maybe it came on at 10. So I think it's important when you're winding down to remember, give yourself at least an hour before bedtime where you put away any kind of work, any kind of news, any kind of social media, and you're just kind of doing the things you want to do that are not going to elicit any kind of stress right before bed. Even sometimes some phone calls can be kind of stressful before bed. So I think it's just good to save that time for yourself come up with a really good PM routine that consists of maybe 3 to 5 things you do in the same order every single night, that just like Mr. Rogers, help prepare the body and brain to know that sleep is coming.
Yeah, and I think to build off that and to build off what Brett has said, the common theme you're probably hearing us say as a pre bed ritual is to wind down the nervous system. And I think what we see a lot when it comes to persistent pain, especially pain that is arthritic in nature, is that a lot of people don't just have, one knee or one hip. It's usually both knees or shoulders, their back, their whole spine. And a lot of times in those conditions, we see that the person's just overall body is overly sensitized because it is in so much pain. And what happens is, your mind and your brain are on overload and overdrive. So when you're trying to go to bed, if you've been anxious throughout the day, or you've had a lot of things happen, or if you're utilizing your room as a place where you eat, where you watch TV, where you do your work, it's hard for yourself to associate the bed or the bedroom as a place of relaxation, as a place of calmness. And so if you think about your body as having an alarm system, you want to try to calm it down so that the alarm system for pain is not, going off all the time. And so, whether it's stretching, whether it's reading a book, whether it's doing, breathing exercises or meditation, find something that you feel can calm you down. And I think what Natalie said is really important, is look at your bedroom, or at least your bed, as a sanctuary for only sleep and intimate relationship type of sexual activities. You'll hear a lot of sleep experts say that the bed should only be utilized for sleep and sex. And I think that's a really important theme, because unconsciously, oftentimes what we'll find is if we're doing work in bed, we're looking at social media, or we're on our phones in bed doing stuff that stimulate our brains. It makes it very hard for us to calm that nervous system down. And that, I think, is something as we see a lot in, as Natalie said, the cognitive behavioral therapy for insomnia approach, which when you look at the research is outstandingly effective for things like insomnia. And again, if you couple an approach like that with doing some gentle stretches, taking a shower, getting some warm water on you and doing some stretches there, whatever you feel is helpful for relaxing, I think can be very helpful to kind of wind down that nervous system, to calm down the alarm system, so to speak.
I'm happy that you brought up a warm shower. So are there any other alternative therapies that can help dial back pain? We had some questions about heat therapy, including saunas and acupuncture. Any thoughts on that?
I just want to add one thing about heat, and that's because I've seen a lot of patients with heating pad burns. So please don't fall asleep with a heating pad on. I can tell every time a patient has the burns, and it's not like you get these blisters, or probably you can. They come in and their back is all mottled and discolored. And by the way, that's like a tattoo. It's permanent. It doesn't come off. It doesn't wash off. So don't fall asleep on a heating pad. You can use heat for 20 minutes on, then you got to take it off. And you need that. You can do that to loosen things up. Some people might prefer ice. And so using simple things like heat, ice, a massage chair, a sauna, a hot tub, steam room, anything like that helps to loosen you up and relax you, great. But just be careful with the heating pads falling asleep.
Yeah.
I am guilty of sleeping with my sleeping pad. It is sitting right under my bed, always plugged up. So
Just be careful.
I think that's a good point. And for me, there's kind of two different camps that can occur with heat. In some arthritic cases, I have seen where heat can actually be a sensitizing element to their symptoms. So there may be some people who say, my knee hurts. If I put heat on it, it actually makes it worse, or maybe feels more swollen. That's totally the case. You're not damaging anything, and you're just overly sensitizing that area. So sometimes people, they say, you know what, I like putting ice on it. That helps me relax. Totally fine. Heat, ice, the research shows that one's not necessarily better than the other, especially for arthritic cases. And then I think I saw some comments in the Q&A about, taking a hot bath and how that's been shown to help with sleep. Absolutely. Especially if a bath is something that, again, calms your system down, causes you to decompress from the day. It's just an extra step for you to get to that step. So anything that allows you to feel that way, heat is one of those things that can do that. But a lot of people will read and say, oh, well, isn't that making me hot? When we sleep, shouldn't we be in a cool environment? Yes, but a lot of what is understood about taking a hot shower or a hot bath in particular is that the heat is actually the warm water is drawing your temperature towards the surface and actually cooling you down a little bit. So there is a thought that may be actually cooling your body temperature, which can help in that way. So some heat exposure beforehand, I think, could potentially help relax, especially if you find that it helps with pain, calms your nervous system down, and then potentially can drop your internal body temperature, which can be kind of a feed forward mechanism for falling asleep physiologically.
And just a simple point, if you want to do that, take the hot tub or the warm bath 20 or 30 minutes before you're going to bed, so it gives you a chance to cool off. I use hot tubs all the time at the end of the day, and as long as I do that for 20 or 30 minutes before, I don't get so hot when I get in bed. So just timing.
And lastly, to cap this section off, let's discuss supplements. What are the best supplements for sleep, and what's the best way to safely take them? Can they interact with arthritis medications? And Dr. Kloth, could you get us started? So I know we touched on melatonin a bit already, but what are your thoughts on melatonin and CBD medical cannabis?
Well, the melatonin, as was Philippe pointed out, should make sure the quality of the product usually doesn't interact with medications, but always double check with the pharmacist and your doctor. I think you had a couple of other medications there that we're talking about, like CBD and THC. Pure CBD has been shown by some people to be helpful for sleep as an anti-anxiety. And I think is actually endorsed by the American Arthritis Foundation but one of the National Arthritis Foundations for pain. And so pure CBD can be helpful. I would urge you to look at the more water soluble than the oil-based products. The oil soluble does not get absorbed well, and so a waterable soluble will have as much as a 400% level higher than an oil soluble. So it's just about knowing the quality of the product. Everything you buy over the counter is not the same. And there's a lot of garbage out there with CBD, quite honestly, because as I think Natalie said before, it's unregulated. THC is different than CBD. Now, sometimes products have both CBD and THC. THC can be also effective for sleep and pain. You have to be careful about interacting with other medications. If you're elderly and you're using that, you might get confused. So again, it's something I would discuss, but could be useful in the right patients. And I have many patients who use either CBD and or THC products for both sleep and pain, and they can be very effective and use even in combination with other medications, but under my direction.
Absolutely. So what about your thoughts, anyone on the panel, your thoughts on using magnesium as a way to wind into your sleep?
I mean, I'll just tell you, for me, I use magnesium with patients who have leg cramping. So people go, I can't sleep because my legs cramp and they wake me up in the middle of the night. Sometimes that can be from electrolyte abnormalities, and that can be calcium, magnesium, potassium. Very easy solution for that. 2 chewable Tums a day and either a glass of orange juice or a banana a day will give you all the potassium, calcium, magnesium your body can absorb. It's a very cheap, easy way to get it for most patients. Dehydration can make your legs cramp. So for me, magnesium is predominantly for people with a specific cause for their symptoms. There are some studies, and I looked it up because somebody brought it up in this forum about that, and there are a whole group in society that looks at magnesium and its use for sleep. I think a lot of what they admit, there was a lot of it is still in research and in studies, but it is something that's being looked at.
I'll just add a little bit to that, because all the time these days, especially, a lot of my clients come in and they're like, I watched the Huberman podcast or the Matthew Walker podcast, and he said tart cherry juice, L-theanine, and chamomile capsules. And not to say that those things might not have a place. I'm not trying to say that, but I would say the evidence on those things is very weak. And I have yet to have a client who I've had to take tart cherry juice that just all their problems went away. And then I never saw him again. So if it seems like it's too easy of a solution, the answer is it probably is. And I would totally agree with Dr. Kloth. Usually magnesium, really just if there's leg challenges, like any kind of weird sensations in the legs, things like that. And since I'm an occupational therapist, I usually just tell them, go back to your doc, talk to your doc, get a blood test your magnesium, and talk to them about it. It's not going to hurt if you're having that leg cramping to try it. But other than the leg cramping, I don't think it's sometimes I think it's pawned off to be like, well, if you have sleep problems, take magnesium and they're gone. And I don't agree with that. I would say that I have yet to see that, but would totally agree with some of the leg cramping, and be careful again with some of those other random, I'm sure there'll be 200 more by tomorrow of different things that you can do to help your sleep, but the research just isn't really there to back it yet.
Thank you guys for all of those wonderful suggestions. Our next topic is all about setting yourself up for a good night's rest. Lots of people who registered for the webinar said pain not only made it harder to fall asleep, but to stay asleep. So Dr. Neilson and Dr. Shepard, as the PTs on the panel, can one or both of you share the best sleeping positions for common sites of joint pain?
Yeah, happy to, Asia. We wanted to share some resources and information on, setting yourself up for, good sleep and maintaining sleep through the night based off of your environment and sleeping surfaces. So the first thing that I wanted to just chat about, because we get asked as medical providers all the time, like, what's the best mattress or what's the best pillow out there? And unfortunately, there isn't necessarily a best. It all comes down to the individual person. So this comes from Diane Macedo's book called The Sleep Fix. And again, I'm not promoting her book. I don't have any, royalties or interest in this book. It is a fantastic book. And this little chart comes from it. And I just think it's a really nice visual. So this is called the line test. And in your handout and on the next slide, but we can stay here, Asia, is kind of the how-to, but I'll just kind of briefly talk through this. But essentially what you want to do is expose your mattress. And so you want to take all the sheets off, and you either need to set your phone up or a camera at the level of your bed, and either have somebody else take the photo or use a timer in order to snap a photo. But essentially, you want to have your bed exposed, your camera set up, and then you want to lay in your normal sleeping position on your mattress. In the book, she recommends not using a pillow at all. I would actually recommend starting with a pillow, since you're going to be sleeping with that pillow during the night. Now, you can certainly do this test, with pillow, without pillow, to kind of further figure out, is it my pillow that's affecting things, or is it my mattress? But how this works is once you're, laying in your kind of comfortable, usual sleeping position, you want to take a picture. And then from that picture, you want to draw a line. So you may need to print this out, or you can draw an imaginary line kind of bisecting through, your head and your neck, all the way down through your torso, through the middle of your legs. And so what you're seeing here on top is kind of the just right. So if you're laying in bed and you can kind of mostly draw a pretty straight line, that means your mattress is, supporting you well, your pillow supporting you well. And so you've got kind of an optimal setup. Now, if your mattress is too soft, you're going to find this sagging, right? So as you draw your line, it's going to kind of sag down. And that's going to indicate that your mattress is too soft or your pillow is too large. So you may need to remove your pillow, take another picture, and see if your body changes. And that would help you further diagnose whether it's pillow or mattress. At the very bottom here is going to be too firm, right? So if your mattress is too firm and it's not allowing you to kind of cushion in and to support your body, you're going to note that your line kind of maybe goes up a bit. And in general, we're not looking for a perfect line, right? We're looking for a close to, straight line. So some deviation is going to be normal, but you don't want to see these kind of big overarching arches. So this is just a really nice way to kind of investigate, how is my sleeping, position right now, especially for those who feel like their bed or their pillow setup may be disturbing their sleep, or they're uncomfortable because of that. Asia, I think we can go to the next maybe 2 slides, because the next slide is just the how-to, which I believe everybody will have it as a handout. So I wanted you to be able to reference that. So this now is kind of shifting gears for those individuals who are dealing with pain and you're trying to find some optimal positions to maybe alleviate your symptoms. So maybe this is even somebody who, starts off the night great, but wakes up in the middle of the night with a lot of discomfort and is trying to find a comfortable position so they can fall back to sleep. So this is lying on your back. And this picture here comes from a program that we use called MedBridge, which provides us with some patient education handouts. But what you're seeing here is different ways that you can use pillows to kind of support your joints. So as an example, this individual here, you can place a pillow underneath your knees, and this might help somebody that's dealing with back pain or hip pain or knee pain. The one caveat I'll have here with knee pain is that it should not be a long-term solution. Keeping your knee in a flex position all throughout the day and then also at night while you're sleeping can lead to what's called contractures, which is really the inability to kind of fully straighten out your knee, which is common in more advanced, osteoarthritis of the knees. So, again, this is maybe more of a short-term fix, but, just be careful with always having always having your knee bent. Up here, I wanted to point out too, in this picture, you can place like a thin pillow or a towel underneath the shoulder to support it here. And that would be somebody, for somebody who's maybe dealing with some shoulder pain, so shoulder arthritis or post-surgical, etc. And then on the next slide, I've kind of got a zoomed in view here, I believe, of the neck. Yeah, so something that we do, a really kind of easy trick here, is to take a towel roll, and I'm usually the hand towel size works best, and you can kind of roll it up, somewhat hot dog style. So if you keep it lengthwise and roll it up into a nice tight roll, that can actually be placed inside your pillowcase. So then it kind of almost conforms to your pillow and can provide you this really nice kind of arch support here for the natural curvature of your neck. So that's kind of a nice way to help manage maybe some neck discomfort or even shoulder discomfort for an individual. Now, I did want to make a note here as far as like optimal pillows. So obviously there are pillows that you can purchase that kind of already have this neck support built in. For some people, particularly those who sleep on their back mostly, they may find those to be relatively comfortable. But for other sleepers, you may find that support is too much or too heavy. And so really the best evidence for pillows is actually to have somewhat of a pillow that's soft but supportive. And so what you should be able to do is actually create a little nest in your pillow. So in the middle of your pillow, it should have kind of a divot or a nest that your head sits in, and then the edges of the pillow are then kind of have all the stuffing, and that natural stuffing is going to help support. So something like a down or a down alternative type pillow oftentimes is going to be really helpful in creating that natural nesting of the pillow. So again, everybody's different. It depends on your preference, and you can use that line test to make sure that your pillow is supporting you pretty well. I think we're going to shift to sleeping on your side. I apologize, the slide title didn't get changed there, and that was my fault. I just recognized it before the presentation. So this is sleeping on your side. So realize this person's got a lot of pillows going on here, and I'm not suggesting that you use all of these pillows at the same time. You certainly could, but I did again want to point out that if you're having back, hip, or knee pain, placing a pillow in between your knees can oftentimes be a really nice solution. If you're having shoulder or elbow pain, placing a pillow underneath your arm or shoulder here, just like this, almost like you're snuggling another person, can also be really, really helpful. And then similarly, that neck trick with the neck towel and or pillows that we discussed can also be used for lying on your side. And again, you just want to find that to be comfortable and not irritating to your neck pain. And then I think the last slide, there should be maybe one more. So this is just a different view, sleeping from the back. So I wanted to point out that you can also place a pillow or a towel roll or a soft pillow underneath your abdomen here. And again, this might be for somebody who is dealing with spine pain. You may also want to give this a shot too if you're finding in the line test that you've got more or less a too soft of a mattress. Sliding a nice little pillow or towel roll in there, how does that change your overall posture while you're sleeping? And that may be something to explore before you go invest in an expensive new mattress. sleeping on your stomach. This is not necessarily a recommended position for sleep unless you already naturally enjoy sleeping on your stomach. If you enjoy sleeping on your stomach, by all means, continue. There's no issues with that. But this isn't necessarily a position that we recommend trying if you're having trouble sleeping. However, sometimes getting in this position you need to because it's helpful or relaxing for your back. We, in physical therapy, have our patients in this position quite often for, exercise treatments or other hands-on work that we may do. So placing a pillow underneath the abdomen here can be helpful and supportive to the spine. Placing a pillow on, underneath the lower legs here kind of gives some space or support for your feet to kind of clear that mattress and not be stretched to their full limits. So those are just some helpful hints as far as positioning goes that you can trial out. And then the last kind of comment just on mattresses too, if you are planning on investing in a new mattress, I really recommend that you look at options that allow you to have a trial period. And then also, if you're going to purchase a mattress, to err on the side of more firm, because you can always add pillow toppers and things of that nature to your mattress. It's really, really challenging to make a too soft mattress more firm. So it's much easier to go the other way around. So those are just some helpful hints, and I'll kind of kick things over to everybody else to weigh in.
I think the one thing I would add, and I saw some questions coming up about, is there a best sleeping position for people? And as Brett mentioned, kind of like with pillows and mattresses, there's really not one particular brand or this is some magical thing that we know about. I have not come across it, nor have I found a patient say or a person say that this is like this has been a consistent thing that's helped me so much. I think the key piece is that you almost have to explore a little bit yourself. As Dr. Kloth said, it's a person by person kind of business here. And so you can work with a physical therapist, occupational therapist, to see what is comfortable, how can we problem solve ways to do it. And as Brett showed you, there's lots of ways to use pillows and towels and things. And I find a lot of people will change positions and they'll find them all over the floor and they'll say, oh my gosh, I didn't sleep with them. What have I done? It doesn't usually work that way. A lot of these things help you get comfortable enough to fall asleep, and then they go everywhere. And then you may say, if you wake up and you're feeling uncomfortable, you can kind of reposition yourself. So I say all these things to not, get anxious about having the perfect mattress or the perfect sleep position. I saw some people in the Q&A are saying that they feel better sleeping in a recliner. Totally fine. Whatever you can do to get the sleep you need and to feel like you are well rested that next day is what is needed for you as that one person there. There is no research that I'm aware of that says that sleeping this way when you have back pain is the best way. So try not to get caught up in thinking about, is there one best way? Look at yourself in the mirror and say, what does it feel like for me? And do I need to explore and maybe work with someone to even help me kind of problem solve through it? And try to think about, what that might be for you.
Just wanted to add one thing that Mark made me think of too. Definitely don't stress about it because it's totally individual. And the one thing that will keep you awake is stressing about it. Stress, cortisol, the cortisol response is why insomnia is an evolutionary advantage. So why do we have insomnia? Because when a lion walked into a cave and snapped a twig, we hopefully woke up, and we did. So the whole reason I'm saying this is because sympathetic response will always activate and get you out of sleep. So the more that you can just say, well, the pillows fell on the ground, I'm going to grab them and get comfortable again and fall right back to sleep. There's no problem with that. There's also no problem with being awake at night, as long as you're getting yourself comfortable and going right back to sleep. So just remember, stress is one of the biggest things that will cause you to be in a vicious cycle of not being able to sleep. So try as best you can to just remember you're doing the best you can. That's all you can do. And stressing about it in the moment is not going to help.
One other thing to add, and this is actually not related to a mattress, but pretty simple about your room. Make sure your room is dark. The darker your room, the less light stimulation. And there have been definitely studies that show if you have extra light coming in and there's light shining on you while you're sleeping, you're not getting as deep a sleep. And so it's important that you don't have the TV on, which is you think is what's helping you fall asleep. Well, if you do put it on a timer so it goes off about automatically, because that light in the background, it's keeping you somehow conscious, awake a little bit, and it's better to have that complete silence and darkness.
I always tell my patients, how dark should your room be? Dark enough to develop film. That's how dark your room should be. So blackout blinds have the corners and the sides and light gets through. So it's really important to fully block that light or get a sleep mask. So I love that you mentioned that too, Dr. Kloth.
I do want to follow up with something that you mentioned, Natalie, the dreaded elephant in the room, sleep anxiety. So one patient did write beforehand that pain has kept me from getting a good night's rest for so long. Even when I'm not in a lot of pain, I'm worried that I still won't be able to sleep. And I think this is all too relatable. So do you have any tips or additional tips for people dealing with bedtime jitters?
Yeah, so I think number one, it's just kind of learn about sleep. There's so much that we can't cover here, but I think knowledge is power, and we don't really learn about sleep anytime in our lives. So there's a lot I want to tap on. I think it was Brett had said something about dysfunctional beliefs about sleep. And actually in the research that I've done, I have found that that has been a huge factor that is contributing to people's sleep anxieties. It's just we don't fully understand why do we sleep? What does sleep look like? Do we cycle through phases? Should we wake up at night? Do I have to get 8 hours? I think it's important to address all of these questions to truly understand, does everyone need 8 hours? No. And I think sometimes just understanding that that is not something everybody needs, and you're not deficient in any way if you're necessarily getting less than 8, can help to just kind of calm some of those anxieties. So I think knowledge is power. A great book that I think covers some of these things, which again, I don't get any royalties for, it's just a good book that I recommend people read, is Quiet Your Mind and Get to Sleep by Rachel Manber and Colleen Carney. It just has a lot of great ways to talk about, it is a CBTI book, but even if you're not going to do CBTI, it kind of just goes through some of these myths you can dispel about what good sleep is. So I think that's important. I also think it's important that you're addressing that stress throughout the day, that it's not something that you're repressing all day, not thinking about. I don't want to think about it. I'm just going to shove it back. And then an hour before bed, it all kind of escalates. We are not able to repress things. The human brain does not repress things. And if it does, it comes at a cost, which is rebounding later. And it always rebounds when you're on autopilot. So in the shower, driving, right before falling asleep, when you wake up in the middle of the night, if you've got stresses, they're going to come up. So I think it's important to address those during the daytime, to be using practices like relaxation, progressive muscle relaxation. Not everybody needs or has to do mindfulness and meditation. They're great. They're wonderful tools, but there's other relaxation strategies that you can use as well. And then again, just remembering stress is the reason that insomnia and sleep trouble in general, it can be exacerbated by. So if you're severely stressing about sleep, it's not going to help. So usually what I tell people is, I'll give you a little metaphor that helps me. If you look at gardening, if you garden, you can do everything during the day that you can to take care of that plant. You can give it sunlight, you can give it food, you can give it water, you can do everything possible to allow that plant to grow, but you can't force it to grow. You can sit and yell at it, you can say, darn it, grow plant, but that's not going to change how fast the plant grows. It's very similar with sleep. You can do everything you can to prepare for the act of sleep. You can manage your pain. You can do some of the strategies we're going to talk about in just a second here, some of the other behavioral strategies. You can look at your positioning, but at the end of the day, if the actual act of sleeping you're having trouble with, there's no way to be frustrated or curse your way out of it. The minute you get mad, it's over. It's going to take you longer to fall asleep. So trying as best you can. I usually tell people have something in the room. If you have and you're safe, my suggestion usually is if you're super anxious, don't get into bed. Wait, read a book, do something, take a shower, find a way to relax, because getting into bed when you're stressed out is not going to make you fall asleep. You're just going to be stressed in bed, and now you're relating your bed to frustration and anger and sadness. Really, a lot of my patients will say, which is so totally understandable when you're not sleeping. So I think prepare as best possible, but if the actual act doesn't happen, have some things that you can do, even if you're getting out of bed, if you're safe, move to a chair in your room and just get out of that bed and read a book, watch a television program, do a crossword puzzle, do some more stretches. Just get yourself out of that vicious cycle of I have to fall asleep. And if I don't fall asleep, tomorrow's going to be sucky. And tomorrow can't be sucky because I have to do all of these things and I can't call into work again. And when you get caught in that, it's just going to take longer.
As we wrap this particular section before we move into the Q&A, I wanted to know if anybody on our panel had anything else that they wanted to add, anything that they think is super influential and needs to be said.
The only thing else I'll add, another cause of difficulty sleeping could be peripheral neuropathy. And we were going to touch on that. Peripheral neuropathy is damage or irritation of the peripheral nerves, and it can cause a burning, tingling sensation in the legs and feet, sometimes the hands. And when that occurs when you're trying to sleep, it can make it difficult to sleep. It typically actually bothers people when they're going to sleep because they're not distracted. During the day, you're busy, things are going on, and you can be distracted from that, but it bothers them at night. For that, there are a lot of different medications that can be tried. One of the most important things is try to keep the neuropathy from getting it worse, which means you have to understand what's causing it. If you have diabetes, it's getting your diabetes under control. If there's other chemicals or something that's causing it to get worse, try to avoid those if possible. Obviously, it might not be possible if it's, say, chemotherapy, but there are a lot of treatments for peripheral neuropathy, and there are even some injections and neuromodulation therapies that can help it. So there are ways to treat that.
And I just wanted to add, because I just said it, if I were to tell a patient come in and they can't work with me, they say, what's the one thing that you would ask me to do that I can start doing today that can help me with my sleep? I would tell you a set wake time. I don't have time to explain it right now, but I can tell you a set wake time for a lot of my patients who have chronic pain has been incredibly helpful in regulating the circadian system. Circadian system regulates about 80% of our physiology and helps with things like inflammation and things like that. So regulating the circadian system with a set wake time, not necessarily bedtime, but a set wake time is crucially important. And then along with, like we said before, making sure your bedroom is for sleep and not for all the other things that you've probably started doing in there because you don't sleep, which is understandable. But trying to pull those things out of the bedroom can be really helpful. And again, a set wake time. Those are two things you can start doing right now that I think could be really helpful.
Thank you guys all for such a great discussion. And now we'll take some time to answer questions from the audience. So our first question, how do you deal with restless leg syndrome and interfering with sleep? And clarify if this is the same thing as the tips for peripheral neuropathy that Dr. Kloth was.
So restless legs are different than peripheral neuropathy, are different than leg cramping, and they're all different things and they're treated differently. Some medications have some crossover, but they are in general treated differently. There are some specific medications for restless leg syndrome, such as Requip. Some people will use some of the anticonvulsants like gabapentin or pregabalin. So there are a number of medications that have been tried for that. And so some things can be done for that. That is different than peripheral neuropathy, but some of those same medications can be effective for peripheral neuropathy. So there is crossover in the type of medications we use, but they're definitely different conditions.
And if you're having restless legs, make sure you get a blood test and they test your iron and they do a full iron panel. So blood serum and ferritin. And today research is showing that your ferritin needs to be at about 75. So even if it comes back normal at about 40, they do now say if you have restless legs to up it to 75 and then see what your symptoms are like before trying some of those other medications. So definitely get your iron tested when you're looking at that.
Yeah, and I'll just chime in too from a movement perspective. So there's some nice research too to show that your activity level during the day. So if you're not getting a lot of movement and activity during the day, it's kind of when you're in those autopilot modes, your body's going to want to move. So if you're getting some nice movement and exercise during the day, you're going to likely find that you may have fewer symptoms in the evenings. If you are having symptoms in the evening, sometimes just some, really nice gentle stretching. So getting up out of bed, doing some nice gentle stretching of those muscles can also help kind of calm them and allow you to get back to sleep.
Absolutely. Before we go to the next question, I want you guys to keep in mind that we received several questions before and during this event. We will try to get through as many as possible, but for questions we don't have time to get to, we strongly encourage you to visit the Arthritis Foundation helpline at arthritis.org/helpline. So let's get to our second question. Lots of questions about other medications used off label, specifically Trazadone and Gabaverton. Any thoughts? One person said they have extremely dry mouth from Gabaverton, and excuse me if I butchered that prescription.
Well, you're saying gabapentin, which is the same drug as Neurontin. Dry mouth is not a common side effect from that. That's actually much more common with amitriptyline or nortriptyline or some of the tricyclic antidepressants. That might occur even with duloxetine or Cymbalta. I imagine there is probably a small percentage of patients who will have dry mouth with or dry eye with gabapentin, but I don't think that's a common side effect. The other drug they mentioned again, could you remind me, was trazodone. Trazodone is really a benzo, as I recall, and so you're back into this vicious cycle that we talked about, where the more you take it, the probably less effective it's going to be, at least in my experience.
Thanks. No, similar experience. People use it, it's helpful, and it's usually given at like a third of the dose that the depression, I think it's a depression medication, but usually it's like 150 milligrams for depression.
Oh yeah, that's right.
Like 50 milligrams for insomnia or for sleep trouble, sometimes 100. But again, people take it, it works for a few weeks, and then it tends to be less effective again. So if you're using it specifically for sleep, I think it's good as a short-term remedy, but it's not going to be your long-term solution.
Yeah, like, so for gabapentin, let's say you were taking gabapentin for nerve pain. If it made the nerve pain better, then you might sleep better long term because it's treating the nerve symptoms. You don't feel the nerve symptoms. If you're using it because gabapentin has some sedative properties associated with it, you will get tolerant to those sedative properties relatively quickly. So if the drug is treating an underlying condition, it might work long term. If it's purely the sedative side effects, that you'll become used to fairly quickly and it won't work long term. And yeah, it trazodone, I forgot, it is an antidepressant. Thank you for reminding me, Natalie.
There's so many meds. It's hard. I don't even know how you begin to keep track of all of them. I just do the selfish ones with sleep, so it's a lot easier.
So question for our PTEs. Best stretches to combat morning stiffness.
Yeah, I think Brett and I probably have some ideas on this, but morning stiffness is a challenging thing. I think you might be able to say that if you do more stretches before or more activity before the day before you go to sleep, that maybe the morning will be better. But I haven't seen a correlation of that. What I will say is that being more physically active as a whole, I think does help with morning stiffness. And I know this is a completely different talk, but I wholeheartedly believe that what you are eating is a huge predictor of probably how you will feel in the morning as well. So that's kind of off to the side, but there's lots of stretches you can do in bed. A lot of stretches, depending on the body region, you can do any stretch for any body region in bed. So, there's a lot of different things you can do. And for people who have arthritic conditions that are typically stiff in the morning, I do usually try to give people stretches 1 to 2 that they can do in bed before they get up, just to try to, grease the joints, if you will, get the body prepped for doing some movement. And then some other stretches they can maybe do after they get up and go to the bathroom, start getting ready, depending on what their challenges are. So it's hard for me to say, oh, do this stretch or whatever, because it's so region specific. But yes, talk to a physical therapist. If you're working with a personal trainer, they might have some ideas there, occupational therapists, and the like. But Brett, I don't know if you have any specifics there for this question.
Yeah, no, I think you pretty much covered it. Really first thing in the morning, to kind of circle back to that specific, typically what we refer to as range of motion exercises can be really, really beneficial. And again, this might be something a skilled physical therapist can kind of, help you with, depending on the exact body region. But, just as an example, if it's my elbow that's really stiff in the morning, I can, just really nicely in and out, really slow, controlled movement. And that's going to be a range of motion type of exercise, progressively increasing the amount of motion that I'm taking that joint through. So that kind of could be applied to really any stiff joints throughout the body, but definitely seek help from a physical therapist to gain more specifics, because every patient is different. Or every person's different.
I think starting with these therapies and stretching exercises is a great way to begin with all of this and using conservative approaches. if you have a specific joint like your hip or your knee, which every morning you get up and you can't move it, it's very painful. Well, that's a joint maybe you want to go speak to your doctor about, and maybe that's the joint they should inject, whether that be with a steroid or a lubricant or whatever might make it better. So if you have 10 different joints which are involved, obviously that becomes more difficult. But when you have more limited numbers or a little bit more isolated area, so that your doctor may be able to help you with.
Okay, another question from the audience that I am personally interested in, as I have my lavender and eucalyptus right here on my desk. What about essential oils for sleep and pain?
I just think you want to be careful. Some essential oils can be alerting to the system and some can be calming. So, and each person can be a little bit different. So you just want to be really careful. I have a funny picture that I'll show some people because they're like, well, is it going to help if I, have lavender at night to help me sleep specifically? And I'll show, there's a picture of a woman and she's in bed and she's just covered in lavender, the actual plant. And she's like, can I sleep yet? And I think it's just a little bit of a joke, only that I think they are calming, they can be relaxing. But you just want to make sure there's not too much of it in the room, because if you've got too much of a sensory situation going on, sensory stimulation at night should be lowered for our system. So while it can be calming, I just think you have to be careful that you're not having too much sensory information going about the room at too high of a rate that it could just be almost disruptive. I don't want to say it would be disruptive, but could be. So I think it's good to use them. I just think use it with having in mind that it's probably not going to be something that I think there's not a lot of research to show it's overly helpful. And I just think you have to be careful how much you're using, what time of day you're using it, all that kind of stuff.
Natalie, while we're on you, any app recommendations for sleep?
Ooh, I should have wrote this down. There's one through the VA that's free. I think it's CBTI Coach.
CBTI Coach.
Yeah, it is.
So that one's free. So I think that's always a great place to start. Free is wonderful. And it's a good app. I've had a lot of people tell me that at least as a starting place, it can be a great starting place to introduce you to this. I truly believe in a stepwise model. And what I mean by that is, I think it'd be great to get the app. It's free, download it, see what it has to offer. Of course, talk to your doctor first, by the way. Always, always, if you have not talked to your doctor about your sleep issue, start there. Then again, CBTI Coach, it's free. I think it can have a lot of good information in it. And then I would say that book, Quiet Your Mind and Get to Sleep, that one costs, I think it's like, I don't know, $20 or less on Amazon. Again, I don't get anything for saying that. It's just an easy to read book. It's got a sleep diary in it. It can just help kind of walk you through the process with a little more detail than the app might have.
Absolutely.
Somebody
So,
asked.
go ahead. I'm sorry.
Yeah, somebody asked, what's the name of the app again? CBTI Coach. And it's both on iOS and the Google Store or Android.
Perfect. That's something I might actually download too. I currently use the Calm app and it is expensive.
Also, if someone reminds me too, there's a BSM listserv, so a behavioral sleep medicine listserv that I'd be happy to give to the Arthritis Foundation so they can post it. It's just a link that clients can go to. You put your state in, you put who you're looking for to work with on sleep, what you want to work on, and it's got a whole list that has been developed by the behavioral sleep medicine folks to kind of guide you with specific information about that person, where they work, all that kind of stuff. So I'd be happy to share that link. That'd be the next step once you use the app and the book and talk to your doctor if you're still having issues.
So we have a couple of questions that I'm going to try to get through. And the next one is, any information about Naltrexone?
There's some physicians who believe that is a medication can be used for pain. I'm not aware of it being used for sleep, although maybe there are some properties. Not something that I use frequently for either one.
Can bedroom temperature affect sleep quality and pain? I know we did touch on it a little bit, but one person also asked about taking a cold plunge before sleep to help the pain. What are you guys' thoughts?
I could take a stab at this, but I think bedroom temperature definitely can play a role in your ability to sleep comfortably. Colder is typically better, but it could be really challenging for people in the summer months or even in the winter months, depending on where you live, to keep it around 65, 67 degrees is typically what's reported. And I don't know what the rest of the panel thinks here, with a cold plunge. to me, that would almost actually wake the system up a little bit and probably get the sympathetic system moving, the fight or flight type of response. So I almost think that, that wouldn't be my first place to go, but there are people out there that will probably say, it works for me. So whatever kind of floats your boat, but that would not be my first place to go.
I think it'd be good for the morning.
Yeah.
So, does age play a role in needing more or less sleep and its role in pain?
I think age is oftentimes thrown around so much, and I try to not lean on age. I always tell people I work with that age is a number; it's not a destiny, and that there's a lot of kind of myths about age and sleep. That you don't need to sleep as long when you get older. That's not necessarily true. There are some people I saw comment saying that I have to sleep more now that I've gotten older. That could be totally normal. Your body will do what it feels it needs to do to recover from the day. With age and pain, we actually see that the older that someone is, typically they have less pain, believe it or not. That's mainly in the research. So again, it might be a little skewed, but usually in the middle point of life, in your 40s and 50s, that's where we see people who have the most prevalence of painful conditions, and then typically starts to come down in prevalence at the time. So I don't think age necessarily predicts whether you'll have pain. I think your lived experiences, if you've had trauma, if you have a lot of body areas involved, is probably more of a predictor of whether you're going to have pain and sleep disorders and dysfunctional sleep than age itself. So if you're older or younger or whatever, don't get caught up in the age game, because I think it's super easy, and it can oftentimes be a bit depressing, as people get older.
Couple things to add to that. There are certainly studies that show as you get older, you probably need less sleep. And so don't be concerned if you were getting 8 hours and now you're getting 6 hours. That may be your body's natural. I would say the only thing is I would have a little different experience with people get older. As you get older, more body parts break. People talk about the golden years. That was when, people died at age 50. Now people live to be 80 or 90. I call those the rust years. And when you enter the rust years, body parts start to break down, just like cars start to break down. Cars, and horses we put out of their misery, they go to the junkyard or the glue factory. Humans, we just keep torturing. So if you have various body parts breaking, it's your hip, your knee, your shoulder. And I have patients, it just goes from one joint to the next joint to the next joint because they have arthritis, especially if it's degenerative osteoarthritis, or even if it's a connective tissue disorder. It is going to spread and it's going to get into various areas, and there can be increasing areas of pain. But what I find is as they get older, they tend to get used to it and more stoic about the pain. So I don't know if that's that they get less pain, but they're sort of used to managing painful things because they've had so many things during their lifetime, and you become, I think, a little better at managing it.
And our very last question, what about adjustable bed foundations for better sleep? What are you guys' thoughts?
I think if I'm understanding the question correctly, that's like maybe the adjustable bed. I don't know about the foundation specifically, but I do know some people have sleep number beds, or the beds that can change and to recline or whatnot. I think, again, whatever you can do to feel comfortable is the name of the game. Again, there's no mattress that I feel like is best. It's just, whether you can feel like you are in a safe, comfortable environment. And so if that works for you, then that's great. And again, as I think Brett mentioned, there are a lot of mattress places now that allow you to trial the mattress for up to 3 months, I've seen. And I think that's a great option. So if you go and you're looking for a mattress and you want to, not feel like you're spending all this money and you're all in, I would ask to see if there's a period of time where you can kind of feel it out and see how it feels. So sometimes we don't know in the 15 minutes that we're in a sleep mattress store. So just something to consider.
One quick thing I'll add too is just that the ones that can raise you up can be helpful for snoring. I will tell you, if you snore, you should go get checked out for snoring, because the snoring is not going to go away. Snoring makes snoring worse over time. So it's only going to get worse if you're already a snorer. But getting yourself up just a little bit of an incline can definitely help reduce that snoring. So that's the one thing that I know, that incline, you can get a bolster or something like that for that too. You don't have to buy a Sleep Number bed, but that can be helpful for some of those breathing type things.
Asia, I was just going to add one more thing on mattresses, and something I didn't touch on is that your mattress, if you have a bed partner, it may be difficult in selecting a new mattress. And something that a lot of people don't necessarily think about is that you can actually have two separate mattresses. So as an example, two twin mattresses come together and they form the same shape and size as a king. So you can have separate, bedding. I know me and my wife have different comforter tops. She likes a weighted top. I don't. So you can have those separate spaces, but still be in the same space. So something else just to consider and think about.
Absolutely. Well, as we get closer to time, I know that this was such a great and enriching conversation. I do want to say thank you so much to our panelists, our guest experts, for lending their time and expertise. As a patient and staffer, I am personally grateful and looking forward to implementing some of the things I learned tonight. Hopefully, I can get in bed by 9 o'clock, put the pillow and the rolled towel under my neck, and get some great sleep. So thank you so much, guys.
Asia, thank you. Great job.
Thank you so much.
Thank you, everyone.
Thank you.
All right, guys. Thank you. So some tools and resources before we sign off for the night. Just a reminder that we have several events to help you manage your arthritis. So we do have the Live Yes Connect groups. The Foundation's Live Yes Connect groups are a great way to support and learn about positive coping strategies to manage arthritis. Groups meet in person and online. You can visit connectgroups.arthritis.org for more information on how to join a community that understands you. We also have webinars like the one you're on now. Every month, the Foundation offers free webinars hosted by nationally recognized leaders in arthritis care. You can learn more about these events, including how to register and view past recordings at arthritis.org/webinars. Next month, we'll discuss the best ways to get started with an arthritis-friendly exercise program. We'll have an exercise physiologist, personal trainer, physical therapist to help us understand the best exercises and tips to personalize a program that is right for you, and you won't want to miss it. We also have Walk to Cure. It's almost walk season. Help us raise funds for better treatment by forming a team and finding an event in your area. You can go to arthritis.org/WTCA to register and find an event in your area. Also, check out our podcast. Quick reminder that we have the Live Yes podcast for even more tips and real talk about arthritis from experts and patients who understand it best. You can find that arthritis.org/podcast. Also, remember, the Foundation's trained staff can help you navigate arthritis challenges, from treatment questions to insurance questions and more. That is at arthritis.org/helpline to learn more. And the survey. Please note that in a few days, you will receive a survey asking about your experience. Please take the time to fill out the survey completely and honestly so that the Foundation can best serve you in the future. And last but certainly not least, we'd like to thank our sponsors, AbbVie, Janssen, J&J, and Bristol Myers Squibb, for providing the support to help make this event possible. Thank you so much for joining us. And on behalf of the Arthritis Foundation, thank you.